So many days, week after week, month after month, we discuss the responses to the coronavirus on this program and the way so many of them, right from the start, have been over the top and unreasonable. So many responses have been unnecessary and counterproductive. So many measures have done more damage to society, to individuals, to livelihoods, to families and businesses than they have done to the virus. Victoria was over the top from the start, of course, imposing more draconian measures than all the other states for longer, and a lot of good that did them. Now, under Premier Daniel Andrews, they're still opening up too slowly, setting the bar too high for easing restrictions like getting kids back to school, opening businesses, allowing people to get back to work, to study, to do something approaching normal community engagement. We've shared the detailed views of many medical and other experts on these issues over a long period on this program. And today, the Federal Health Minister, Greg Hunt, speaking on Sky News to Peter Stefanovic this morning, put the case directly to Premier Andrews.
The Prime Minister, the Treasurer and myself respectfully asked Victoria to review those thresholds. The epidemiologists, people such as Professor Peter Collignon, Professor Catherine Bennett, the Dean of Melbourne Medicine, Professor Kapoor, have all indicated that they are concerned that those thresholds may mean an inadvertent long-term lockdown, which would mean that small businesses, restaurants, cafes could be almost permanently trapped in a cycle of closure or reclosure.
Yeah, as I said, you've heard from many of those experts on this very program, and on this station you will have heard from Melbourne GPs such as Stacey Harris, who wrote an open letter to Premier Daniel Andrews last week. It was co-signed by another 8 GPs and a professor in general practice. It said in part that due to the continuing harsh lockdown, the children, young adults and new mothers I mainly treat are in anguish, despair and have no hope. The purpose of this letter is to plead with you to look at what we can reopen safely. We will still protect the vulnerable and elderly and continue important public health measures of social distancing, mask wearing and hand sanitisation. The letter focused on a tripling or more of mental health consultations, kids traumatised and suicidal, financial strain feeding into the crisis as doctors face a huge health crisis that's much more than COVID. Harsh lockdowns like here in Victoria, said the letter, are doing more harm than good. I implore you to review this urgently to provide hope for us all. Powerful stuff. These are the experts, medical experts. As you know, GPs are also community experts, family experts. Now, since that letter, of course, Premier Daniel Andrews has dropped the curfew and eased some restrictions, or at least announced his intention to ease restrictions. But schools still won't return until the second week of next term and only from year 6 down. And today the Federal Treasurer shared his frustrations.
I've read letters from well-regarded doctors and GPs, and the number of cases that they are seeing through their doors skyrocketing, providing antidepressants to kids as young as 12 and 13 as a result of this lockdown. So I say to the Premier, follow the medical advice, but please get Victorian children back to school at all levels.
It's clear the Premier needs to get out of his COVID bunker and listen. Instead, he seems resistant to any sensible debate and discussion about his coronavirus response. Listen to this exchange yesterday with journalist Rachel Baxendale, who we'll be speaking to in a moment, about why people walking on their own in regional Victoria should have to wear masks.
If someone by themselves in regional Victoria going for a walk, you know, and there's no one else in the same square kilometre as them, it's a bit silly for them to have to wear a mask though, isn't it?
But what's the issue, Rachel? Well, seriously, what's the issue? Why is it such a massive issue to have to wear?
It serves no health purpose if they're not
yeah,
in contact with another human being.
Well, that's an esoteric debate, really, isn't it? That's not really like, and if maybe there'll be a time when we have the luxury of having those sorts of debates.
This is extraordinary. The lunatics of Twitter were abusing Baxendale over that exchange, but what does it tell you about Andrew's mindset? He seems to think any draconian measure is justified unless you can make a case against it. He's got the onus completely the wrong way around. And he says a discussion about being forced to wear masks is esoteric when people are being arrested and fined for not wearing masks, even when they're walking on their own outdoors, tens of metres away from anyone else. That's not esoteric, Premier. That's your own citizens demanding some common sense and demanding some basic liberties, like being able to walk in a park on their own without your draconian, unscientific measures turning them into lawbreakers. I keep saying it, but this bloke needs to take a few days off, go for a walk himself without a mask, and reacquaint himself with reality.